Please describe your line of work.
Okay, well, I am a registered nurse. I work on a C-section postpartum unit. My unit is separate care, so we provide care for women and babies on my unit, but it's not like one nurse for a mom and a baby. It's one nurse for the baby, one nurse for the mom. Which is good and bad, but let me just talk about my responsibilities. So, as a nursery nurse, when I'm caring for the babies, I'm responsible for making sure their blood sugars are okay, making sure they're eating every 2 to 3 hours if they're on the breast, every 3 to 4 if they're on the bottle. I'm responsible for their first bath, just making sure that their overall health is good. I do daily assessments or shifts. Every shift I do an assessment, and every 4 hours I do vitals. I also weigh the babies, make sure that their weight's okay, check their jaundice levels, all of that stuff. As a mommy nurse, like I said, it's a C-section postpartum unit for the most part. So our patients are all post-op, like med-surg. I need to get them up to ambulate, walk to the restroom, clean them up. I put undies on them. I explain to them how to care for themselves, what's an appropriate amount of bleeding, signs and symptoms of hemorrhaging. Make sure that I'm advancing their diet properly. That's and I work night shift. So yeah, it's a lot of fun because that's what night shift is, when most of the moms will really want to be learning how to breastfeed. So that's a huge responsibility of mine, whether I'm a baby nurse or a mommy nurse. I'm always helping to breastfeed.
What made you want to be a part of this profession?
Well, forever I was really interested in caring for people, and I know that sounds stupid because who doesn't really care for people, but I actually wanted to like nurse people. I wanted to find out about the human body. I wanted to see how I could help and fix and do anything, that I could to help heal their health and their soul and their heart and all that stuff. That's what attracted me most to nursing. Was I felt like as a doctor I wouldn't be able to achieve quite as much one-on-one patient care as I would as a nurse. And also, I'm really not interested in surgery. But let me just reread that question again, because oh yeah, and especially in my particular field, I worked as a medical assistant in obstetrics and gynecology, and I loved it. It was incredible. I loved being a part of that amazing experience that women get to go through. Um, so that was pretty much it. I just was so attracted to that moment because I don't think that there's anything more beautiful than the moment that you meet your baby for the first time.
Would you say that your job requires a lot of writing?
Oh my gosh, the amount of charting that I do. Yes, absolutely. I would say I spend, uh, I could perform an action and then it takes me longer to chart an assessment than it does for me to perform an assessment. Let's put it that way, which is really sad. Um, there's certain things that obviously take longer to do than to chart, like walking a patient for the first time. I just chart patient ambulated, they did okay, whatever. But assessments take a long time to chart. And I have to chart everything, especially in postpartum, because sometimes legal issues come up between parents. And so I'll have to chart mom is detached, or mom is showing symptoms or signs and symptoms of maybe postpartum depression, all those kinds of things, and I have to be very very specific, so that requires a lot of typing, not handwriting but lots of typing.
How often in specifics would you say that you write in your field of work? Like,
Oh,
how many hours do you think you put into it?
oh my gosh. Okay, well, I know when I have 6 patients it usually takes me about 2.5 hours to chart all of my assessments. um, this all depends. If I have 6 vaginal delivery patients, it's typically a lot shorter. There's a lot less to chart than for a surgical patient. But when I do have 6 C-sections, yeah, I'm sitting there and I'm charting for 2.5 hours, and then additionally I'll be charting throughout the night. I have to chart pain assessments. Every time I give a pain medication, which is Q4, every 4 hours for Percocets, and every 6 hours for Motrin. Sometimes it's different, but for the most part, I'm charting throughout the night. I would say like probably four, 4 to 5 hours of my shift is spent charting, which is crazy, but yes, it's true.
What types of writing do you do on a daily basis for your job?
Charting. I do write on the board. When I initially come into the patient's room, I write my name and my phone number on the board, and I'll write, like, whenever I'm getting a new patient, I'll write congratulations on the board, and I write like certain instructions and things like that that they need to follow through with. So things like breastfeed every 2 to 3 hours, bottle feed every 3 to 4, one light on in the room at all times. Please, don't forget to order breakfast, lunch, and dinner. Kitchen closes up, blah, 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 blah. I'll write those kinds of little reminders on the board for mom and for dad, because it's hard to remember all those things. But that's pretty much that, and charting in the computer basically is it.
Do you find any part of your writing difficult? And if so, why?
I think charting on the computer is really hard because it's night shift and I'm tired, and I mean, even on day shift I think I'd be tired. It's sitting at a computer charting like repetitive things, because a lot of my patients look almost the same on a computer. My patients are all relatively healthy patients. I do get some with like gestational hypertension, preeclampsia, um, gestational diabetes, other kinds of issues, hyperthyroidism, patients that are on medications for different things. So I do have all kinds of patients, but for the most part, it's healthy women that just delivered a baby. And so it's pretty much all the same charting. It gets really repetitive. I really wish there was like a copy paste assessment, and then I could just chart by exception. So like chart the exceptions to the within defined limits things. So because I go down the list and I'm like, oh, within defined limits, and I have to do this for every patient. It's crazy.
What writing is required for your job? Are there any specific skills that you need?
Charting, and the skills that you need to understand